When recovering from an injury or a medical condition, there is no better place to do so than your own home. Here to tell us what Home Rehab Express can do for you or a loved one is Joanne Ellis once again with Home Rehab Express and Dr. Peter Walimire with Athletic Orthopedic and Reconstructive Center. Good morning. Welcome back. So this morning we're going to talk about diabetic foot issues. But first, Joanne, remind people what Home Rehab Express does and the benefits of home rehab.
Sure, Carly. Thank you. Home Rehab Express is a home health care company, and we specialize in nursing, physical therapy, occupational therapy, home health aid services that go right into a patient's home if they are unable to make it to the doctor's office or post-surgical when they're discharged from the hospital.
Yeah, you work with a lot of doctors here in Southwest Florida. Dr. Walimire here, one of them. So talk about diabetic foot issues, and I imagine anytime you mention anything with the foot, I'd imagine there is a place for home rehab afterwards, certainly if there's surgery involved. But talk about diabetic foot issues and kind of, are they pretty common?
Absolutely, they're very common. Thanks for having me here this morning. The most common problems with diabetics are that they develop two problems: loss of blood flow to their feet, as well as nerve problems, which can lead to numbness and eventually sores that form on the feet.
And why is that? Why is that more common issues with people who suffer from diabetes or are battling that?
They tend to have higher levels of cholesterol, which lead to plaques in the arteries, and so you get less blood flow to the feet. When that happens, the nerves are affected. They develop less blood flow, and that's the main theory of why peripheral neuropathy forms, is because of lack of blood flow to the nerves.
Is there anything you can do to prevent it, or what do you think people should know if they're watching this morning who have diabetes? And
it's important for any diabetic who is starting to develop burning, tingling, numbness in the toes, or some temperature changes to the toes, to see a podiatrist regularly. That's something I assess every time I see a diabetic patient, is how well is their, or how good is their blood flow to their feet. And I do an assessment of their nerves to see if they're still feeling everything normally.
So the temperature of their foot will actually change too? That's pretty interesting.
Well, you see some color changes and a little bit of cold feelings to the toes if you're losing some blood flow there.
As we close, anything else people should know, or kind of last minute reminders?
If you're a diabetic and you do have peripheral neuropathy, check your feet regularly. Make sure you're not developing sores. And if you see any signs you're concerned about, follow up immediately with a podiatrist.
So act fast.
Definitely. That's the key.
Well, Joanne, if anyone has any questions about this, or maybe what your office is able to do, what your team is able to do, what would you have them do?
I would have them ask their doctor to send them to Home Rehab Express for home health care, or they can visit homerehabexpress.com.
All right. Well, Joanne and Dr. Peter Walimire, thank you so much for being here. We look forward to having you guys back. And for more info, you can also head to our website, fox4morningblend.com.